One of the players that came in for LASIK was a very curious case. This player had a great daytime batting average, but he had a poor nighttime batting average. LASIK has advanced to the point where not only are we measuring how good someone's vision is by looking at the chart and saying, oh, they're 20/20, but we're also looking at how sharp their vision is. And how we measure how sharp their vision is we look at what's called higher order aberrations. And what higher order aberrations are is the clarity of the vision. So some people are on a chart can see 20/20, but they say that the letters are blurred, that they can see that it's a letter E, but it's not sharp. And what that is that's a measure of higher order aberrations. And now we have technology that can measure how many higher order aberrations you have. So when this player came in, one of the things that we noticed was he was nearsighted. But the other thing is that he had a lot of higher order aberrations. So now with LASIK, we can correct not only their nearsightedness or farsightedness or astigmatism, but we can do something to help their higher order aberrations. So when this player got his LASIK, not only did we get his vision at 20/20 without glasses and contact lenses, but we reduced his higher order aberrations. And what we found was that year, after he had his LASIK and after he improved his higher order aberrations, he got improvement in his nighttime batting average. And that was the thing that got him to the next level, which was the major leagues. Now, one reason for a decrease in higher order aberrations is the size of your pupil. And one of the things that we have on that card that we gave you is pupil size. So usually what happens is the larger your pupil gets, the more higher order aberrations you're going to have. So some people in the light will have very small pupils, but what happens at night is those small pupils will expand, and the reason is at night there's less light, so how your eye responds to that is opening up the pupil so that you can get more light in, and so so that you can see better. Well, you can maybe see better in terms of reading on a chart, but what happens is you get more higher order aberrations, so you get halo, glare, and those things that can distort the vision. So one of the things that we've done with certain baseball players that have a lot of higher order aberrations is we give them drops to make their pupils smaller. So say they don't need a LASIK procedure and say they don't need glasses, but what happens is their pupil gets so big at night is they get so many higher order aberrations. We give them a drop that makes your pupil just a little bit smaller so that their higher order aberrations are decreased and now they have clearer vision and they perform better out in the field. So one thing that you can do is you can check your vision with the light on and have somebody see how big your pupils are, and then check your vision in the dark and see how big your pupils are. And again, the bigger your pupil is going to be, the more higher order aberrations you have. Now, if you want to specifically measure your higher order aberrations, you're going to have to go to a LASIK surgeon and he'll give you a scan and he'll be able to tell you how bad your higher order aberrations are. One interesting study that one of the doctors in the Sports Ophthalmology Society did was he went to training camp and he measured all the players and their higher order aberrations. And what's very interesting is minor leaguers had more higher order aberrations than major leaguers. And there was a difference in the better hitters had less higher order aberrations. So the hitter that tested the best in terms of having the least amount of higher order aberrations was a Hall of Fame baseball player.